Thank the senator from Nevada. I don't know that there's a state that's going to be more impacted by cuts in health care for seniors than my state of Florida. 3 million Floridians on Medicare, almost a million on Medicare Advantage. And I think it's worth repeating what these cuts are going to mean. $137.5 billion from hospitals that treat seniors. I talked to the director of a hospital district down where I'm from in South Florida. He said these cuts will be devastating. $120 billion from Medicare Advantage, $14.6 billion from nursing homes that treat seniors, $42 billion from health care for seniors, from home health care, and $7.7 billion from hospice care. Now, yesterday, our friends on the other side were trying to convince us and the American people that there's not going to be any cuts to benefits. It's not going to affect health care for seniors because they're going to pay less, but that'll just get rid of the waste and the fraud and the abuse. Well, everyone is against waste, fraud, and the abuse. We have a measure on this side of the aisle that actually I think would do something about it. And we have gone through the Reid bill to find all the provisions. My staff and I have been going through it line by line to find all the provisions that go after waste, fraud, and abuse. And there are some, to their credit. But the Congressional Budget Office has said in their report that came out on November 18th that the provisions that go towards waste, fraud, and abuse would cut $1.5 billion and create that efficiency, but the cuts are $464 billion. So if they're going to save $1.5 billion and there's going to be $464 billion in cuts, where are the rest of the cuts going to come from? It's like my friend the senator from Tennessee said, seniors are getting thrown under the bus. You're not going to be able to cut $464 billion, only get $1.5 billion in savings, and not cut benefits. So seniors who want to go to the hospital are going to have benefits cut. Seniors who have home health care, their benefits are going to get cut. And all the way down the line. So everyone needs to understand that at its base, this is a bill that hurts seniors. And perhaps no state's going to be impacted more than Florida, where we have this huge population of seniors. I know that my friend from Nevada has a huge population of seniors in his state. We have the highest per capita number of seniors. And we like to say, you know, all the rest of the seniors in the country are eventually going to move to Florida anyway. So we're going to have the greatest generation. We have them there now. We're going to have more of them living in Florida. And their health care is going to get cut. This bill cuts from health care for seniors. It raises taxes. And it doesn't decrease the cost of health care for the 170 million Americans who have health insurance now. In fact, for some, it raises it. So for me, a new member to this body, it just doesn't make any sense. But what does make sense is what my esteemed colleague from New Hampshire has done with this amendment. Because if you're for health care for seniors and you don't want it to be cut, and if you're really true to your word that we got to put the savings back into Medicare, then this bill, which says, as its purpose, to prevent Medicare from being rated for new entitlements and to use Medicare savings to save Medicare, I cannot imagine that anyone could vote against that amendment. Because if you vote against that amendment, you're voting against senior health care. And I'd like to ask my colleague from New Hampshire, who has so much experience on these budget issues, if this amendment doesn't pass, what's going to happen to the Medicare program?
Well, to begin with, it's going to be reduced by $460 billion the first 10 years. In the second 10 years, it'll be reduced by $1 trillion. And in the full 20 years, it'll be reduced by $3 trillion.